one piece of that assessment is how many vaccines do you have on board? But then also going to the medical team is what's your ability to be able to handle this with vaccines? But the other piece of it is it's very infectious, and it can spread quite easily. So if we don't have enough vaccines, what does that mean?
Hello, everyone, and welcome to the Paratus Podcast, the emergency preparedness podcast. Today, I'm very happy to have with us Jennifer Snow. Jennifer is a public health leader with over a decade of experience in infectious disease management, outbreak response, and health protection across both local authorities and large-scale operational settings. She's led diverse teams through complex incidents, developed training programs, and worked across everything from chronic disease prevention to major community outbreaks. She is Canadian and spent most of her career in Southern Ontario before moving to the UK in 2022, where she recently transitioned from maritime public health to a shoreside health protection role. She holds a Master of Public Health and plans to begin PhD studies next year, focusing on infectious disease syndemics and disease ecology. Outside of work, she has 2 teenage children and a very energetic young dog who keep life busy and grounded. Jennifer, thank you so much for taking the time to join us today.
Oh, thank you. Thanks so much, Jean-Francois. I appreciate it.
All right. So I'd love, Jennifer, if you could get us started. Tell us a little bit. Let's say there is a cruise in the middle of the ocean and the medical team realizes that there are a few cases of something that seems to be related. And, one of the crew members thinks it might be chickenpox, for example. So I'd love
Okay.
if you can run us through a little bit. What happens? Is there someone who gets alerted? What are the first steps?
Yeah, no, absolutely. Yeah, it's an interesting thing within, I think, the cruise industry, because when you look at shoreside sort of public health, government-based public health, we have really sort of tried and tested sort of legislation and surveillance within those systems, within our healthcare systems, whether that be in the US, Canada, Europe. We have those systems in place. But when you're in sort of a corporate model where you're basically running little towns all over the world and across the globe, then, we have to develop sort of our own surveillance types of systems within that. And so we do syndromic sort of surveillance, which is really about, we'll keep an eye on what sort of little over-the-counter medications they sell in the shops. And, if we notice certain things going, then we're like, ooh, we'll pick up on those things. Our crew members who are doing housekeeping in the cabins are actually trained and taught to look out for certain things. And they're also trained to look at, little clues and hints that maybe people are ill or not well. And, so that our medical teams can follow up. But then we also have our medical teams on board who are like a little hospital and a little care clinic on board. And so we have a close connection with them in terms of being able to have sort of close surveillance. And so, we do a lot of training with our medical teams in terms of being able to pick up on those things, to be able to know when it's important to raise it. But we also have our own digital surveillance systems with case management and clinic management on board. And that also helps us to do surveillance on shore. And, we could just look at epicurves. We could look at reports of, recently reported diseases or suspected diseases, because we have limited testing on board. So we often have to go with the medical expertise of the team in terms of what they suspect is the most likely cause of illness in the guest. So we do have a system, where I worked there was a very clear system of clear communications to the shoreside teams. We have health operations, and we also have public health. And so there was a clear communication and triggers that we set. And that's a really important thing on the ship, is to be able to have a policy that really gives us a good idea of thresholds. And once we breach that threshold, what that kind of next step is. And so we would look at that, make sure everyone was aware of it, and then that communication would come in as to when we had a case. And then we would be following up with 100 questions to the medical team in terms of, starting the case and the contact management. So those were kind of the first steps. And chickenpox is a really interesting one, because I think anyone who works in public health on shore would say, why would you even be interested in chickenpox? But everyone gets it. It's a childhood disease, you get it and you get over it. But we have some unique needs on the cruise ships in comparison to what you might see on shore. And therefore it is a disease of concern for us. Absolutely.
So you were talking about reporting. I'm curious, when you
Mm,
say that you have all these systems in place, are these automatic? Are these
mm,
like, how does it work for you to receive the information? And I'm guessing
yeah.
we're talking about one ship, but there's more than one in one of these
Yeah.
big companies. So is how does that work exactly? The reporting and the information getting to you from these people.
It's really quite challenging in some ways, but it does work because of what we've established in the relationships that we have between ship and shore. But the main challenge, I think, is while cruise ships aren't necessarily unique. I mean, we have them all over the world, and there's thousands of companies or hundreds of companies. The ability to get software, for instance, even just surveillance software that would be specific to the needs of a cruise ship, is actually really not out there very much. There's not been a lot of development around that. There are some basic pieces of software that we use, but it is more based on a clinical management side. So, patient management, patient files, notes, etc. on patient visits and clinical visits. But we have managed to be able to pull some data out from this software that does it, but it's focused very much on gastrointestinal, because obviously when people think of cruise ships, they think of norovirus, gastrointestinal disease, as well as acute respiratory infections. So COVID-19, obviously, influenza. So we really only have sort of decent surveillance that we can pull from in those categories. But for anything outside of that, it actually is a bit more difficult. So we don't have the software available to us. So for gastro and RE, acute respiratory infection, we do have to manually go in, look at epi curves, look at that. We have policies that have the thresholds and the markers that we need to look out for depending on the size of the ship. So that is sort of a manual system that becomes automatic from the shoreside team. Every morning you log in and you start looking at the numbers and what's going on. That's why it's so important to have a dedicated team in these companies to do that. And I'm not sure they all do necessarily. But the other part that we have when we have something that doesn't fit in the box that the software allows us to use is we have to do training and have very clear policies that the ship and the shoreside teams can use to make sure that that communication between shore and ship is very clear in terms of what's required. So that is really all we can kind of do. So some ships also have public health officers. So if they see something kind of odd going on, different behaviors, rumors spread wildly on cruise ships, so if we start to hear murmurs of something interesting or unusual, we will often also follow up with the medical team. But, 95% of the time, it's a clear email or phone call communication from the ship to the shore to alert us of any concerns that they have with any infectious disease.
Okay, so communication, clearly reactive stuff, but also proactive
Yes.
from the people on the short side. I understand. Now,
Yeah.
it's funny we were talking offline because chickenpox, for example, on a cruise ship, obviously you are inside a confined environment with people from all over the world. It's funny because
Yes.
in Canada, people are vaccinated, right? So kids don't get chickenpox anymore. But
Yeah.
you were telling me in the UK, the vaccine is only very recent. So people were still getting chickenpox. So
Yeah.
how does that change the dynamic? The fact that there are so many people from so many other places that are confined inside that space for a defined amount of time.
Yeah, it's really interesting. And as I was saying to you earlier, I was a bit taken aback, having been in Canadian public health systems and the government side and looking at communicable disease control. Chickenpox was never really that much on our radar. We would look at school absences, but then if someone said, chickenpox, okay, but that didn't even happen as much because we now have the vaccination. We've had it for a number of years. My kids were vaccinated quite young for chickenpox and never really exposed. So yeah, in the UK we have that. In a number of other countries, we don't have the same kind of vaccination program, and I'm really happy to hear the UK does now. But yeah, the one thing about the cruise ship is it's a floating little city, little town. Not so easy to just, depending on where you are, we've had voyages where they're, at sea for 10 days, 12 days, with no ports that close by. It's really challenging in those aspects. The biggest challenge with chickenpox, or varicella, as it's also known, is with regards mostly to the crew. So, what we often see is after summer break, spring breaks, school breaks, we often keep a really close eye out for chickenpox in the crew, just because, again, we have a population in, sort of Western Europe and the UK that are getting chickenpox at a very young age because it's endemic. But our crew are what we call a naive population that haven't really been exposed to chickenpox before. Because a lot of the countries they originate from, chickenpox is not endemic. It is
Mm.
not found normally. It's not a childhood disease, a typical childhood disease. And typically, the older you get, the more challenging chickenpox is. It has much bigger health repercussions when you're older, potentially, and it's a higher risk. I even remember my uncle as a child he was getting chickenpox. He was in his 30s, and he was out for a long time and really very ill. Where I had it for a few days and a week, and I was fine. The risk with that, with our crew, is, of course, the level of illness, and how much they're going to struggle with that. But the other piece of it is it's very infectious, and it can spread quite easily. Now, and the crew work very closely together, and they live together. That's their home. They're sharing cabins. They're all together. They're eating together in the same places. They're working closely on the ship together. There's a lot of potential exposure with a lot of people and a lot of interactions. And so that's worrying. And then when we start to see crew going down with chickenpox, we also start to run into challenges in terms of just operating the ship. Those are the people who keep the ship running. If they all start going down with chickenpox and start becoming very ill, the ability for the medical team to manage that gets really tested, because we also have guests that we need to also take care of. We have other crew. We just have the general operations of the ship and how we're able to do that. So that's why, and obviously the health and well-being of the crew are vital, completely vital to us. So that's why it really sets off alarm bells when we start to get chickenpox, and we have a very low threshold for when we really declare an outbreak, because we want to make sure that we get a really quick handle on this, and we start that contact management and also start looking at vaccination and starting to get exposed crew that have never been vaccinated or exposed, to start getting them vaccinated. And we have a very tight timeline for that to be effective.
Okay, yeah. So let's talk about that. So
Mhm.
there are a few cases the medical team realizes, contacts, you on the shore side. There are 3, 4 cases. You're worried. What happens? Are there, strict protocols that are already in place? I'm guessing there's already people know a little bit what to do in terms of guidelines. And take us through what would happen then.
Yeah, absolutely. The key piece of it is really having very robust policies in place. That's really at the heart of it, but also robust policies that you can also adapt a little bit to the situation as it evolves. And so that's where sort of the public health expertise, the medical expertise comes into play, and why we're there. Because otherwise, you could just follow policy and you wouldn't need me there. You wouldn't need, our medical teams there. So that's a really important part, is having a very clear policy on what those next steps are, verifying that those next steps have taken place, going through it, reassuring with the team, these are the expectations, this is what needs to happen next, making sure that we're having a very clear communication. And it's not just with medical teams, but we also need clear communications with a variety of stakeholders, and going through the process and the policy with those stakeholders. Because when you are on a cruise ship, it's a business at the end of the day, and reputation, how guests are communicated to, what guests think, like we were saying earlier, sometimes some of the measures we might put in place might cause panic amongst guests, and we don't want that because we don't need to panic. So it's a really, again, we have a very clear policy, step 1, 2, 3, 4, but then we have to look at the nuances of the situation, and that's the shoreside team and the medical team, and just, the general, like, hotel teams, the captains, all of those people on board, to get a sense from them of what the situation looks like. What are we looking at? What are we dealing with? What are going to be potential implications? Also, what's realistic? So it's also, we have to do sort of an assessment of those things. One piece of that assessment is, how many vaccines do you have on board? if we have a large exposure, I've been involved with one where we had, two crew maybe that were exposed from a guest, we assume, but then they were in a big meeting and spent a long time, when they were infectious, but before they presented symptoms, where they potentially exposed about 40 people in that meeting. So then we're looking at that and we have to do all that contact tracing, find out who was there, find out who, it's a lot of work, find out how many had already had chickenpox, how many are vaccinated. But then also going to the medical team is what's your ability to be able to handle this with vaccines, people, the contact tracing, all those kind of things. So there's a lot of steps that you can't necessarily write out. It's not black and white, and you have to adapt to the scenario. So if we don't have enough vaccines, what does that mean? And, working with our senior leadership, with our brands, with regards to what the risks are, what our opportunities are, are we going up to a port with another ship that has vaccines? Can we borrow some from them? Can we go to the port agent and get some from, a local, like a pharmacy? So there's all different kind of tools that we might have at our disposal based on experience that we can pull from as well. So experience, understanding the situation, because it's going to be unique for every ship, and having really good, strong, trusting relationships as well with our teams on board, but also with our non-medical, non-public health parts of the business, because that's another part of it. You need to have that trust and that good relationship for them to listen and accept maybe some suggestions that might not be very popular. That's another key piece. Sorry, I'm not sure if I fully answered the question there,
That's
but
perfect. And there's a couple of things I want to unpack in there. So first of all, you talked about vaccinations. I didn't, I mean, it makes total sense. I'm just
Mm.
surprised. What can you vaccinate for? Like, you can't hold vaccines for every possible infectious
No.
disease. So are certain, and I'm just surprised that there are vaccines on board a cruise ship.
Yeah, yeah, they do hold some, and it's based on an assessment, and I was never too involved in this, but the medical leadership within the company, and based on evidence, and there's also certain agreements with different regulatory bodies in terms of what would be required on a ship. And again, based on that evidence and based on what we know about chickenpox with crew populations, that is one that is seen as quite important to be able to help control any sort of outbreak or increase in cases. Depending, I don't know about a lot of companies, there's been some debates as to whether vaccination should be required for chickenpox specifically before boarding, because some
Mm,
vaccinations are required before you
interesting.
can come on board. You have health checks for crew and all of that. You have to pass certain medical tests. Again, not my area of expertise, but there have been debates on whether, because of the impact it can have, do we have crew vaccinated before they come on board? But again, we know vaccination programs requiring people to do certain things, even availability from where they're from may not be there, the cost, all those kind of implications have to be considerations for that. But yeah, we do have a few vaccines that are available on board, as well as certain specific, obviously, medications. It's, that is determined is probably important to have. And then otherwise, when we do go into ports, we can look at getting supplies sent to the ship. We have systems in place to send emergency supplies. Sometimes it's literally putting someone with a case on the plane and getting them to the ship. So depending on the situation, not vaccines, because cold chain is a bit challenging, but that's something they look at and determine based on risk.
Very interesting. You were talking about adapting policies.
Mm.
I'm curious, these policies, do you find that personnel are very aware of them? Is there like training that goes on? Or is it
Yeah.
that there's gastroenteritis is so frequent that just people are used to this kind of thing? Or is it a mix of both?
Yeah, it's a mix of both of those. The one thing I learned, which was really interesting going into the maritime industry, and this is across the board, not just public health, com- it's very focused on compliance. Compliance is key in the maritime industry. Well, compared to when I was on shore, we had policies, and I'm always kind of like, oh, policy. It's great, but you can't just read policy and know what you're doing. You have to have experience. You have to learn from all these things. You have to adapt it. Public health is gray. It's not black and white, and policy is black and white. So, but moving into the maritime industry, that was a real, like, sort of learning for me, was how strict it is in terms of compliance. So our policy, sort of the holy grail, you had to follow policy. It was mandatory that you must follow policy. And if you cannot follow policy, there is a system in place to actually state, this is why I can't follow policy. This is what I'm doing instead. And then, the person sort of, so I was the subject matter expert for public health. I would have to approve that, or give guidance or not approve it and say, no, you should be following the policy. There's no reason you can't. So it's a very strict. So everyone is required. It's always on your desktop, the database we had for our policies so that you quickly pull it up. That being said, there were times that people were like, wow, I've done this so many times, you don't even need to look at it. But you would always get pulled back into it of, well, the policy actually says, X, Y, and Z. So that could happen, and people could forget with some of the less important sides of it. But it was also part of our role on shore and also from the leadership on board to make sure that it was being put in place. So for instance, the captains have a role to play as the leader of the ship. They are ultimately responsible at the end of the day to follow that policy. The other piece was that I had to work in that nuanced in between where this is the policy, we're following it, but maybe this is how we're going to follow it. So sometimes we tried to word the policy so much that it was more about an endpoint and what we needed to achieve rather than a detail of how we're going to get there. So that was a bit of a fine balance and part of, I think, what my role was to kind of bring that to it. Yeah, because just going on to a meeting and just saying, well, policy says you should do this, that doesn't really resonate with people. So you need to have that relationship, that trust and the experience to be able to implement the policy in an effective way.
Yeah, and I love the fact of making it mandatory, because then there's no question of,
Yeah.
should I know about it? Should I follow it? It's just, this is what it is. I
Yeah.
love also the open-mindedness of still saying, I mean, there's a little bit of wiggle room. We need to, get where we want, but obviously every situation is kind of different.
Yeah.
So let's go back to the like there were 2-3 cases of chickenpox. What
Mm.
happens then? Do these cases get isolated? I'm guessing
Yeah.
there's a
Yeah.
research for close contacts. Take me a little bit into like what happens in the next couple hours.
Yeah, so we would definitely have to do immediate isolation. And there are certain, when you're dealing with crew, you have to look at certain protocols for isolation. If we have a guest with a case of something, we just isolate them in their cabin, fine. But crew share cabins. So we have to oftentimes, and so we have to really look at who are they sharing it with. We have to do an assessment of when they were infectious, looking at when did symptoms start, trying to determine that potential incubation period, that infectious period, and we have to do an assessment. And usually the people on board will do this, the medical team, but also if there's a public health officer, the public health officer steps in and really starts to assist with the investigation. So we need to launch an investigation, get them isolated, care for them, make sure they're well, as much as we can. That's the medical team's role. And then public health sort of steps in to really, you have to hit the ground running with the investigation. So again, that is about determining where the potential exposures are. We would probably consider cabin mates to be exposed. And so we would then start doing that contact tracing, interviewing the person who is ill, the case, interviewing them. What have they been doing? We would interview, their manager, their line manager to say, have there been any events? Has there been, there's crew parties sometimes, or there's big team meetings or things like that. So we really have to do a very thorough investigation of any potential exposures amongst the crew, but it's also even with the guests. Are they front facing with the guests or are they back of the house? Those kind of things, and do an assessment as to whether this is a high risk for guests. And again, that's a whole other area that we would have to consider. And thankfully, I've never really run into that, but that's the first sort of steps, is really starting to do that investigation that you would typically do even on shore in a shoreside based sort of exposure. So interviewing the case, trying to make your best determination based on the information they give you. That's all you can do. And then doing the contact management, which will include asking about, did they have chickenpox as a child? Were they vaccinated? Some people might have been. Or maybe they were part of another exposure that happened on another ship a couple years ago and received vaccination. So looking at records and then developing a vaccination plan for those exposed individuals who are susceptible to developing it. The other piece is if, we've had situations where we've had maybe a lot of people exposed. So then we have to also look at containment and keeping the ship running. So, we have people who may be infectious, maybe in their incubation period, but they're fine. And it's really hard to tell someone who's fine to just go hide, in their cabin and we'll just wait and see. Because at the end of the day, the ship needs to run and we need those individuals. So sometimes we will look at things like PPE, um, you know, also education and communication. So we have instances where we've masked crew because it spread from respiratory. So we will put them in masks to reduce that. We also provide education, because oftentimes first symptom will be, a bit of a cough or starting to get something in your chest. So it'd be like at the first sign of anything respiratory, you need to see doctor. The one interesting thing again about the maritime, because I said earlier about compliance, is we also generally have crew who are very compliant and they listen to direction. Because again, in a maritime industry, you have to listen to your line manager and follow direction because lives depend on it, safety depends on it. So we often have a crew who are very compliant, follow the rules, and will do as we tell them and educate them in terms of those directions. So we'll do that, and then we will do continual sort of observation, getting updates on a regular basis from the ship of any new cases that have developed, keeping track of that, and then basically continually assessing the risk is basically the role. If we're seeing real increases in cases, then I think we need to have, we need to come together and have a discussion of what we're going to do here because we're seeing cases going up and up and up. So what's our plan of action? How are we going to attack this? More often than not, because of the policy we have, which is based on evidence, it's based on what we know from experience, it's usually quite effective in sort of nipping it in the bud. And so oftentimes we don't see an increase. We see a leveling off and then a drop. So at that point, then we would make that assessment as to when the outbreak is over and where we can move on and take some of those precautionary measures off the table. And I think that's basically how we do it. But again, it's that communication is so key, and having that open line of communication and updates between shore and ship to be able to help each other.
That's so interesting because you're in a confined space, but you have people that are used to strict policies. So
Mm,
obviously the public health measures are what are going to stop, the propagation and things from getting worse. And I was thinking the fact that you're in this confined space, it must be harder because there's so much
mm,
contact. But at the same time, no one can get on or no one can get off. So it's easier to kind of know maybe who's been exposed. I mean, you
yeah,
know all the staff and all the guests that are
yeah,
on board. So it's easier to know exactly what your total population is. So I can
yeah,
really see how with these strict measures and these guidelines that you have and all these steps that you've mentioned and being aggressive with confinement and vaccination and all these measures, it can certainly halt something like that from going rampant. What if it
yeah,
does? Is that something that you plan for? Like, let's say it's
yeah.
starting to get out of hand. Are there any pre-planned policies for that kind of stuff, or is it really case by case?
No, it's case by case. I mean, the policy sort of covers what we need to do. And the fact of the matter is, whether you have one or two cases, the basics don't change too much in terms of confinement, isolation, contact tracing, all of those kind of pieces. What you would then need to do is sort of adapt for what you're trying to do. So, things that we've done before, because cabins are, I mean, they're hard to come by. They're full. We generally have as many as we can hold. We don't have spare cabins sitting around, even in the guests now, post COVID, the cruise industry is doing really well and we're often selling out on our cruises. So we don't have a lot of spare cabins. So there is oftentimes with isolation, we have to look at how can we isolate, how can we adjust duties of people? For instance, if it was a gastro, let's say we had someone with gastroenteritis, viral gastroenteritis in the crew. If they're sharing cabin with someone who's in the food area, or in the kitchen, in the galleys, cooking, no, we can't have that. So we have to do those assessments as well with regards to, okay, you need to move here. This person was already exposed or they're in a lower risk. There's all these sort of algorithm we have to follow with how we're going to do isolation, how we're going to manage people in higher risk roles, front facing to the guests versus let's maybe not have that. Let's put them more in the back if they're at risk. So we have to do that. But the other piece that we have to think about in the maritime part of it, that we don't necessarily always think about in shoreside that's different is you're going into different ports in different countries with different regulations. So it is mandatory for every port around the world that we do a medical declaration of health for the ship when it's coming into a port, which basically will list infectious diseases that have been reported on that voyage. And so therefore, we also have to look at how we are going to respond to queries from port health agencies that are there to protect the health of the country. So those are all those considerations. What's the risk? And oftentimes, actually, those agents, I don't know if it's as much with chickenpox, but potentially with other things, they will come on the ship and do an assessment of how we're doing. So they will do sort of a little audit, ask a lot of questions about how we're handling things, and then sort of give us the green light, or give us recommendations saying, well, this is really good, but maybe you should do this as well. And we take that in hand. And we also provide reassurances for how we're going to protect the health of the citizens in port so that we don't cause, damage. That's not, we want to, leave it as it arrived and not change things. So that's another part that we really have to do a risk assessment for. And if it gets really, really bad, I mean, we have an escalation process on shore for incidents with the ship. Just like any kind of emergency planning, we have an escalation system in place that, goes up the line with regards to leadership and pulls in all the different parts of the business, our port agents, technical people, our hotel people, all those kind of people, so that we can have a discussion of what are our possibilities, what could be our next steps.
Is there a possibility that, because, we've been talking a lot about maybe milder cases that we
Uh-huh.
confine people, they get better. What if a certain amount of these people, and, I want to ask you a little bit about COVID in a minute, but
Mm,
let's say they get, it was the beginning of COVID. A lot of people get very sick, need, eventually to be put on a ventilator in the
yeah,
medical bay. And then at some point you overwhelm your medical resources. Is that something that would have an impact on that decision as well of deciding whether
absolutely.
you continue the trip or change the itinerary or turn around?
Absolutely. And I've experienced that. It's really overwhelming. So we do, when we have outbreak meetings, so we will have regular outbreak meetings with the ship between shore and ship with all the relevant stakeholders. And we would have a member from our medical team, health services, in the meeting. And they weren't necessarily there for the outbreak management, but they were there to check in on the medical team and how are you managing? Do you need anything? Is there resources? The other thing is with maritime, and I'm not as familiar with all this, but there's really strict rules for seafarers and how many hours they can work, for safety, well-being, mental health. So there's a lot of restrictions. So we want to make sure people aren't working more than they're actually even legally allowed to for their own well-being. And so that can cause a real issue if we have a team who is overwhelmed, who has every medical bay is full, and they have lots of people in isolation because they have to continually follow up with people in isolation to check in to make sure they're okay and if they need any medical assistance. So that's definitely a huge part of it. And so we will pull in different people and we have had to fly medical personnel out to meet a ship, to help relieve things. We've flown people out to help do contact and case management because it's so overwhelming, and then had to make decisions as to whether, like, look, this is what we're facing. These are the next ports. We don't have a port for this many days. Are we going to be able to do this? And making those decisions. And sometimes these happen. Like, I've personally even received phone calls. It's like, can you get on a plane this afternoon and fly to, such and such a country to provide support? That's the kind of environment. It's very 24/7 and can be quite reactive. We do all we can to be proactive, but at the end of the day, it is what it is.
Yeah, absolutely. I want to talk a little about COVID. You were in
Yeah.
Canada when that happened. I'm very curious to see your general opinion about how has the general public health approach changed
Mm.
post COVID compared to pre? Do you find preparedness has improved, or are people more aware of how this works, or was there no change?
Yeah, that's a really interesting question. And I mean, this is going to be very much a personal opinion and it's a bit of a political question. I think when I look at public health and historically how it's operated, public health is sort of the poor country cousin when it comes to healthcare in general. I think in some places, I won't name any places, but, public health would be 3% of the healthcare budget. It's so minute. And yet, when you look at the scope of what public health does, it's massive. And we always thought, gosh, if you just gave us 5%, what we could potentially achieve would be phenomenal. Obviously, as a public health person, I'm quite biased that I think, prevention is the best thing to do first, and go with prevention, and then we won't maybe see the impact on the healthcare system that we see. But that's not necessarily a politically savvy opinion. I get that, for politicians, etc. And public health, is working really well when you don't hear about it. That's a very common phrase you hear, is if we're in the background and you don't hear about it, that means everything's going really well. And when we're on the front page of the news, things are not going well. So that's a part of it. I think in public health, we're always really hopeful. When SARS hit, this is going to change things. There were, coroner's reports. There was all these recommendations. There were all these things on what a potential pandemic could look like and how we're not prepared. And this was in Ontario, which is where I'm from. We're not prepared. These are the things that we need to do to implement to have pandemic preparedness, because the scientists also knew we were overdue, for a big pandemic. We really were. And it was going to come at any time. And then we had H1N1, I think it was, in 2009, somewhere around there. And okay, a little bit better maybe in trying to get those vaccination programs up and running, but a lot of challenges there. And then COVID. And it's like it really kind of came to the thing is that we're not really learning any lessons here. When we look back at everything that was recommended after SARS in the Toronto area, yeah, a lot of it wasn't really followed up on, and a lot of it wasn't done. And I can't really blame anyone, because it's really challenging, and there's such limited resource. But I think because of how it was handled, I think at the beginning, obviously, and we all know this, public health was really supported, and I remember being in the public health building when we were still in the offices, and people honking and cheering and the banging of pots and all those kind of things to celebrate the healthcare workers and the public health workers. And then there was a point where that just changed and the dial went in the other direction. And I think it was that lack of preparation, all those kind of pieces that eroded a little bit of trust. And I think COVID just really put some of the shortfallings of public health in the spotlight, if I'm honest. Not that and this isn't about the people who work in public health, because they know what they're doing and they work really hard and have a lot of experience, but are quite restrained by resources, policy, legislation, political will, all those kind of pieces. And I think COVID's really, kind of brought a lot of things we all kind of knew into the spotlight. And yeah, we're entering a very different, and I think it's just a very different culture at the moment with social media, the kind of political atmosphere that's happening in a lot of countries such as the US. Those kind of pieces have really impacted public health, and I think it's made us all very cautious in terms of how we communicate now, how we're doing things, how we respond with the public. Building that trust and relationship is, I think that's, to be honest, that's always for me one of the biggest things when I'm dealing with anything, is building a trust and building a relationship and having really clear communications. I think we forget sometimes. I don't think people in public health forget, but I think we forget that's really a cornerstone to what we do, because if you don't have that, you're a bit lost.
And it's great you bring me to that point, because that was exactly my next question. But don't you
Mm.
find that communication piece post-COVID related to public health measures with the population, is that easier? I mean, people now, everybody knows about masking and washing their
Yeah.
hands. Do you find that has changed, or don't know?
No, I think, and I can't, being honest, I think, and this is my experience, so I can't speak for everyone. I think, with some people, yes, okay, it has changed maybe a little bit. But I think actually, with a number of people, it's actually almost become more difficult, because there were mistakes made. There's no question there were mistakes made at the beginning, because we didn't really quite know what we were dealing with. And, it was a bit of fly by the seat of your pants in terms of how is this being spread? What's going on? What's the risk? How do we, all those kind of pieces. Policy was changing all the time. I was leading teams, and It was like, "Oh, there's a new document today, that we have to follow," and then the next day it's like, "Oh, there's been a change, and now we have to do this." And people saw that, and, fair enough, they were like, "Do you really know what you're doing? Like, are you just making this up as you go along? What sounds good?" And I think that eroded a little bit of trust, and I think it eroded a little bit of confidence from, public health a bit too, but I think that's almost made things a bit more difficult because now when you raise them, you're like, "Really? Are you sure?" "Well, that didn't work before, so why am I gonna do it now?" It's just like with vaccination, we look at flu vaccination, it's like, "Well, I got the vaccination for flu, but I still got the flu." And so trying to explain the context and, because it's not easy, and I think that's always a problem with science is we know it's complex and there's no black and white answer, and we're very honest, and it'd be much easier to be like, "Yeah, it's fine," and just brush it off, but we can't communicate that way, we have to communicate risk, and I think COVID has made it a bit more difficult for people to really trust that maybe we know what we're doing or we're doing our best with what we have, and I think maybe if in general we're a little bit more honest about that, I do find people kinda trust you if you're a little bit more like, "I'm baffled, but this has worked before, let's try this, let's do this, and let's see where we get." But that's really hard to communicate to the general public, so, yeah.
Yeah, really interesting. I know you would think that going through an event because of recency and all that stuff helps you get prepared and get all these things out
Yeah,
in an easier fashion if something else happens. But you have a great point that depending on how that thing happened,
yeah.
it might not necessarily make it easier. And yeah, that's very interesting.
I think it's human nature as well. I love history, I'm a bit of a history nerd, and, my first degree was in history, but we look through history and nothing's really changed, with whether it was the plague, the 1918 flu, cholera, all these kind of, outbreaks we've seen in the past. At the end of the day, we're actually kind of very similar in how we handled things over the centuries. So, yeah.
Yeah, it's funny. We thought at some point we would keep our masks forever and not ever
Yeah.
shake someone else's hand again.
Yeah.
And here we go, 15 days later, everyone's back to
Yeah.
shaking hands and
Yeah.
and getting together. I mean, as you say, it's human nature. I think socializing is such a big part of what we do as
It
well, but
is. It
that's very
is.
interesting.
Yeah. Yeah. I struggled with that when things went back to normal. Yeah.
Jennifer, I love it. Thank you so much for going through this with us. Can we do a
Yeah.
couple of rapid fire questions? Is that okay?
Yes. Yeah.
Awesome. I'd like to know, is there something you changed your mind on in the past 12 months?
Well, that's a challenging one. I think one thing I've changed my mind on really is about how important rest is, I think, and how important and the role that plays in leadership. I think because I've, admittedly, like, when COVID was I was pretty burnt out, by the end of it because it was full on for a long time, and, not being with my family when all of this was happening with my children, my partner, and it was a lot, and I felt like it was just so important to be there all the time and to go, 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 to be there for your team, to, you know, be that person that you need to go to, and I've done the same in my recent roles as well, and I think in the last year, having some reflection, that's not the best way. I mean, it's important to be a strong leader, it's important to be, there for your team, it's important to be calm, um, I've had people say to me, like, "You're just so calm through these, situations." And I was like, "Really?" Because inside I'm like, but keeping that calm demeanor and, giving people confidence when maybe you don't have it, but, you need to make sure they feel that and they feel supported. It's also important for me to sometimes step back and take a bit of a rest, take a bit of a breather, to not take all the responsibility for everything in a way. I mean, it's not to let it lay too heavy on me, I think, is something, and to not own it because a lot of it's out of my control. And that's been a real lesson for me in the last, even, yeah, it's been really the last year. I've really learned I need to take a breather sometimes, and, it also helps other people develop, and I can step back a little bit and let them develop a bit more and be stronger because, I always say, "What if I was hit by a bus?" But I'm supposed to say, "What if I won the lottery?" And disappeared. So you need to do that support for people. And I'm, you're no good. It's like the airplane analogy. you got to put your mask on first before you do it for, your children, that kind of thing. So, yeah, it's a big one.
Yeah, totally agree. Thank you for that. What do you believe that most people around you disbelieve?
I think that of how important, like, sort of the basics are, and that a lot of things are actually quite predictable, and we can see these things. And I think, you can kind of sometimes see things coming and you can see what we're dealing with. And I don't know if everyone always believes that, but I think if you really step back and look at the big picture, you can maybe see where things are going. And it was like what I was speaking to earlier about, we had SARS, we had H1N1, and we had all these things. And if you step back and look at the big picture, it's like, oh, but we haven't really done this. We haven't looked at this. If something hits, we're in a bit of trouble here. And you can also just see patterns of how people behave. Even on the ships, we can could look at different behaviors, look at different pieces that were happening and be like, okay, we got to get on top of this. So I think some things, if you keep your eyes open and you really focus a lot on big picture and try not to get too much into the nitty gritty, I think you can actually get ahead of things before they happen or even prevent them. And I do think sometimes people don't feel public health is as much about prevention because it's really hard to quantify. I can't show outbreaks I've prevented, from my actions. It's not quantifiable, but I know it's there. And that's a tough one, I think.
Yeah, what question are you never asked about what you do that you think you should be asked more often? I don't know if that relates to what you just said.
Yeah, it could be. I think one thing that people often don't talk to me about, but I choose to tell them about, especially family and friends, is because I thought about this question, is how it feels. I think maybe again, this is something people don't believe. I don't think people think about the impact maybe on the people who are managing the crisis. And, I mean, we did a bit, I think, with COVID, that came more to the forefront, but I know of people who had some, PTSD and things like that after certain crises. And I don't think a lot of people ask how it feels to do this every day, and to manage these things. And I'm not even sure it was something I thought about that much before, but even during COVID, I've dealt with lots of outbreaks and infectious diseases, and I knew people were vulnerable and could pass away. But I started getting the emails of, reporting of death. And while, of course, I wasn't in the hospital, I wasn't doing that, acute care, which was unbelievable. I really had an impact on me. And I think even just every day, even, managing public health on the ships, managing that level of responsibility that you feel, protectiveness that you feel, but also the positives. So I'm sounding really negative, but there's real positives that you feel like you're making an impact. And I don't think people often ask how it feels. And having that, we talked a lot about, a lot of it's unsure, and having to make decisions that maybe you're not 100% sure of. I really struggle with that. And so, yeah, you don't get that question a lot of like, how do you feel after you do something like that? Or how is it managed? And it's always on your mind. It's always on your mind. And yeah, it's an interesting one, I think, that we don't talk about much.
Yeah, and the decisions that you make impact
Yeah.
hundreds, sometimes thousands of people. So that's yeah, and
It's big
obviously,
pressure.
yeah, absolutely. Obviously, guess you're saying I guess you're saying before you try to take these decisions with other stakeholders, people taking care. But obviously, at the end of the day, if everyone turns to you and says, what's the final decision? What do you think? That's a lot of weight for sure.
Yeah, yeah. And sometimes you're in situations also where you're not really able to even say what you really, really think. And that's really difficult. I find that really challenging. So,
Yeah,
yeah.
absolutely. Last question for you, Jennifer. What are you hopeful for your profession,
Mm.
or public health in general for the coming years?
To be honest, no matter where I've gone and where I've worked and people I've worked with, and I've worked all over the map, I'm really, really positive about the workforce and the public health workforce, which I don't think gets enough credit, if I'm honest. The dedication, I mean, it's unbelievable of the people I've worked with. And, even for example, I've worked with, we have public health officers on ships, and a lot of them didn't actually come from a public health background. Some did, some didn't. But their dedication to the work and the passion that they developed for that just blew me away. And I just continually see that and continually see this passion in everyone. And even post COVID, with the exhaustion that set in people, all those kind of pieces. And I'm also, I guess one of the positive things with COVID is I've seen public health a lot more out in the news and in the world, and you're seeing lots of, different programs to train people being advertised more in public health, and more discussion. So I'm really hopeful with regards to the next generation of people who are going to work in public health, and their passion for it. And yeah, that's really where I see it is I've rarely come across someone who wasn't amazing in what they do in this field. So it's
Awesome.
really special. Yeah.
Jennifer, thank you so much for taking the time. I really appreciate it.
Well, thank you. Thanks so much.